All right, I think we are recording. So here we are, another episode of Carefor TV, and this time we have gone straight to the top. We are speaking with our CEO, Steve Perry, today. Welcome, Steve.
Hey, Trevor.
So we're going to start to get to know you a little bit better. So tell me, who are you? What's your background? How did you come to be the CEO of Carefor?
Well, I'm happily married to my wife, Monique. I've got two fantastic children, Mackenzie, she turns 16 actually in September, and Carter, who turns 10 in September.
Nice.
And we call the Pembroke area our home. My background is in finance, operations, and accounting, with a significant focus as well in construction and redevelopment. I have a BA from the University of Ottawa, an executive MBA from the University of Fredericton, and I'm a committed lifelong learner. I've been with the organization for more than 20 years now, yet it feels like it was just yesterday when I started working here. And I often reflect back to sort of what brought me here to begin with, as a young feller, as they say. And I remember following along in the news at the time. High visibility project and really a contentious issue in the province was the healthcare restructuring that was going on in the mid and late 90s. I was really just getting started career-wise. I was in my early mid-20s. And in the local news, there was a lot about the closure, the impending closure of the Pembroke Civic Hospital, and then following that story, I came to become introduced to Carefor's predecessor organization, VON, in Renfrew County, who had just acquired the Civic Hospital, and I thought that would be an interesting project to be part of, to help an organization redevelop that facility into something new for the community. And I thought it'd be great to do that for a couple of years. And 20 plus years later, I'm still here. Over the years, there were just so many opportunities to learn and grow within the same organization that typically younger people, when they come out of school and they're building their portfolio of experience, they need to move on and move from organization to organization to broaden their skill set. And I really didn't have to when I found this organization. I got to be involved in so many different things. Just as I just mentioned, the redevelopment of a hospital building. Operationally, there was an awful lot going on from an HR perspective, a labor relations perspective, really diverse service offering, new program development, service expansion, mergers and acquisitions, and significant engagement with volunteers and donors in the community, and also getting to work with a very talented and dedicated board of directors. It's all packaged up in one organization, and really, as time went on, I realized that I found my vocation, and there was nowhere else I'd rather be. And I remember vividly in July 2008 deciding that someday my goal was to become the CEO of this organization.
Oh wow! Look at you.
2017, that became reality.
Bang. Make it happen. Okay, so you become CEO, right? You talk about the sort of stages of sort of moving within the organization and finally finding yourself as CEO, your dreams realized. What did you feel like was kind of the biggest surprise about being CEO? What was sort of the biggest learning curve for you to take on that role?
Probably the biggest surprise for me, when you're with an organization for as long as I've been, I was pretty well informed coming into the role, but for me, the biggest, most pleasant surprise was how quickly I was accepted by the staff as a whole in the organization, as an internal successor to a previous long time and successful tenured CEO here previously, my predecessor. I don't mind admitting it was a bit of a daunting task to come in and forge a new path within an organization. But I was really pleasantly surprised at how quickly I was accepted into this new role, and that really energized me helped give me the confidence I needed to really transition into that role and those responsibilities, and to keep being myself, and to do what got me here. And so that's probably what I was most pleased and surprised about. The biggest learning curve was probably the fact that traditionally our organization um, was more focused on our local region in terms of our networks and our outreach, because that's really how the health system's been structured here for quite some time. And so we didn't have a foothold or a presence outside of the Champlain or Eastern Ontario region. And soon after assuming the role of CEO, the health system in Ontario really started to change really rapidly. And so that really necessitated that in my role as CEO, I get much more involved more broadly at the provincial level, different tables, to ensure that we're well informed, we're positioned, we can influence where we could, just to really help continue the organization evolve in a rapidly evolving new direction for the healthcare system. And so for me, probably, getting comfortable in that space was probably the biggest learning curve for me, because it was, very much uh, uh, some uncharted waters from my perspective.
So you step into that role, you're sort of out representing Carefor. You're talking to people about, obviously the sort of healthcare landscape, the community support services, and you're hearing people talk about Carefor. Like, what did you find? And I guess to a certain extent, still, what do you find? We're going through this OHT transformation. What do you hear in the community when people talk about Carefor?
I regularly hear that Carefor is a trusted partner, honest broker, reliable service provider, sort of the traditional can do, will do attitude from an organization standpoint, that's willing to lead if it's asked to lead, to support if it's asked to support, to facilitate where it can, where sometimes, partnership building can be a little bit difficult. And so I really think that's a tremendous compliment to the organization that we're viewed in that light. I can tell you, we're also known to have a reputation for providing very high quality care, to employ excellent staff, and to offer a really comprehensive basket of services. In terms of stakeholders in the broader public, I regularly hear that people know who we are and have an understanding of who Carefor is, which is fantastic, because I'm often surprised that sometimes the audience and their familiarity with our organization. At the same time, regularly I also hear that those same stakeholders or the broader public had no idea how complex we were as an organization, how far our reach is as an organization, how big we are, the scope of services we offer, the impact that we have. And so that's also pretty cool, because I often tell folks that sometimes maybe the perception is that we're some sleepy little not-for-profit charitable organization, and really we're anything but. It's just we go about our business, just doing what we need to do, and sometimes that comes without the high visibility or the accolades or what have you. But certainly very solid reputation amongst a significant cross section of partners and stakeholders.
Yeah. So, that's one of the things about Carefor is we don't build, I don't know, furniture. We're not making cars. We don't have a product per se, right? Like our strength and our reputation, and you kind of talk about it, is our people, like our staff going out in the community and the people that provide them supports and all that. What would you say? I don't know. If you can say that there are characteristics about Carefor's team, and what keeps people here, because there's so many people that have been here for like 10, 15, 20 years. I don't know. I don't want to say like, is there a secret sauce or whatever it is about the Carefor sort of type of person, or who we are as a team?
Uh, to me, despite the fact that we've grown quite large and we've become quite diverse, I can say with a high degree of confidence that the people that work here, the team that's here at Carefor, it really feels a lot like we're a family. I
Yeah.
see that in terms of how we work together, how we interact with each other, sometimes a more social element of work. But I also see that how that translates into how our staff look after our clients. And that's not just from a direct service provision perspective, it's also in those folks in roles who are supporting those who provide the direct care. And really there's a high degree of awareness about, what they do and the impact they have on individual lives. And I just get a sense that the people treat each other and whether it's their coworkers or their clients, like they would want to be treated themselves, or how they would want to have their own family members treated. And really, that's a pretty awesome thing to see and experience and feel. Um, I think it's really indicative of the overall commitment of the individuals who work for the organization. Um, and I think that it's also what's helped drive us forward in terms of our commitment to innovation, to continuous improvement. Um, and probably that's been never more evident than over the past 16 months. I mean, families support each other when the going gets tough, and this family really rallied together. And I'm not going to say we didn't, endure some bumps and bruises along the way over the last 16 months, but man, oh man, I couldn't be more proud of the way we all pulled together, helped each other, helped the individuals in need during a really unprecedented time. And those are just characteristics you see within close family units, and that's really how I characterize um, the type of individuals that work for us here at Carefor. I think that's also led to a high degree of individual and organizational resilience, and that too is very important in family units and in high performing organizations. And I think too, I'm really proud of the diversity that's evident within our team at Carefor. I mean, in terms of skills and experience and cultural backgrounds, we welcome and celebrate that diversity, and we want people from all backgrounds and skill sets to really feel at home here with their family members. And so, yeah, I just look at it as one big family.
Yeah. I mean, a lot of people in any sort of work, whatever it is, often you go, you do your job. And I would imagine to a certain extent, our staff, they show up, they do their job, they support people, and they don't necessarily know how it fits into the bigger picture. Like, Carefor is one organization in a landscape of organizations that are providing supports to seniors and people living with disabilities. What's unique about us? Like, what sets us apart?
I think I would summarize that in three ways. One, I would point out our comparative advantage, which is, there are organizations of different composition, for profits, not for profits, that do what we do out there in the broader health system. But our comparative advantage to most in our space is that everything we do gets reinvested back into the broader health system as a not-for-profit charitable organization. Compared to for-profit organizations, for example, whose mission is to support owners and shareholders and whatnot. And so that's a key differentiator for us in that everything we do gets directly invested right back into what we need as individuals and our neighbors need as individuals, in terms of supports from the broader system. And that's a pretty powerful thing for an organization to be able to boast about. Our competitive advantage is the scope and breadth of the services that we offer. And there are not many organizations out there like Carefor, certainly not within our region, and even provincially. We offer such an incredible basket of services, everything from our home care and community support services to our retirement care facilities, residential hospices, day programs. Like, the list is literally, we offer, I think more than 36 programs and services. And so different funding models and whether they're directly funded or contractually secured or fee for service paid or delivered on a charitable basis. That reach is pretty significant and is really part of the secret sauce that you talked about a little bit earlier. And I think picking up on what I just talked about in terms of the diversity of our workforce, I mean, it's really the diversity of our organization. I mean, if you take a step back and look at us as an agency, we're kind of a microcosm of the province itself. We have large urban centers, vast rural regions. We've got very different socio and economic circumstances within those regions, very culturally diverse individuals working for our organization and that our organization supports. And really that's kind of a mirror image of the province itself, just on a smaller scale. And so, that's a pretty unique feature for an organization to boast about as well.
Yeah, no kidding. So it's interesting when you started talking about your experience, you talked about coming into the organization at a time of great change and seeing opportunity from that change. The last couple of years with OHTs, you've been obviously in healthcare, Carefor much longer than I have. I mean, I've been around with Carefor for a couple of years, and I'm just amazed by the amount of change that seems to be taking place. Where do you see, how do you see this comparing with what you've experienced up to this point in your career? Where do you see it going in the next 5 years? And kind of how do you see Carefor as being able to be a part of it?
I was thinking about that very thing over the last couple of weeks, really, and I can say with confidence that in my time in the healthcare system, so 2 decades plus, there's always been a degree of change going on, change and evolution. But never before have I seen the amount of change that we're going through right now, and we'll continue to go through over the next few years as well. There's absolutely a significant amount of disruption and transformation going on right now. The elimination, for example, of the LHIN structure in 14 regions that sort of were the makeup of that LHIN structure, the establishment of the Ontario Health Team model by the current government, and the enabling legislation that's been put in place to do that, the emergence of Ontario Health as sort of the overarching structure that will be responsible for the Ontario Health Team model, and then that overlaid with the emergence of basically a 3-region geopolitical model within the province, which has really Carefor, working with providers who are based in Toronto, because our region is Central East,
Right.
And so our sandbox has gotten quite a bit larger than it was historically, and that's okay, but it certainly necessitates that we continue to evolve as well as an organization, and any healthy organization ought to be looking to continuously improve. Our strategic plan certainly has us on a path to support us in a journey of organizational renewal, and the timing for that could not be better. We're going through an awful lot of internal change management that is both challenging and exciting all at the same time, an awful lot of work, but incredibly important to keep pushing forward with that work, given the amount of transformation that's going on in the broader system. And I think that we can continue to rely on a reputation as a really well-established, trusted health service provider in the system to carry us forward into whatever the future has in store for us. But we're currently involved in approximately a half dozen emerging Ontario health teams just within our region here in Eastern Ontario, and we've been sought after to be leaders within those teams, and relied upon to do some of the heavy lifting that's needed as those models start to take shape and move toward implementation stages. And really, that's just a testament to all the things that we've talked about here already today. And so, I would just summarize by saying that we couldn't be better positioned in what's increasingly a disrupted health system environment right now. And as long as we continue to embrace that as an opportunity and rise to the challenge, we're going to not only are we going to survive, but we're going to thrive and continue to grow and become an even more dynamic organization. And really, that's what energizes me going forward. There's just so much opportunity out there for us that we just need to be ready for it.
Yeah. Okay, so I don't know if you answered my next question, which is my last question. All the way from whatever, Pembroke, all the way through Pembroke Regional or Pembroke Renfrew County, all the way to the Quebec border, wide range, 36, whatever, 3 dozen different programs, change always sort of happening on any given day. What's the thing that you look forward to most when showing up at work?
Honestly, it's just getting to be around people I enjoy being around, whether it's the staff I get to work with every day or the clients you get to interact with. It's just a great vibe and a great environment, and I really drive my own motivation and energy from getting to work with really committed, caring people who are here for all the right reasons. And I truly do look forward to walking through those doors every day. There's, I've said in the past several times, I can't say I ever remember a day where I've been looking at my watch and thinking, geez, is the day over yet? It's just, holy smokes,
Yeah.
the day's over. And where did the week go? I'm looking forward to meeting with that team tomorrow, and I'm excited about this open house we're going to have to get to talk to some of the people that we don't get to talk to as often as we might like. And when you can find and be a part of an organization where that's what your day and your week is like, it's a pretty cool thing. It also means time flies, and we all get older. But certainly, yeah, it's going to happen anyway. So you may as well really enjoy the ride. But also just doesn't really matter what setting we find ourselves in. Pretty much every day, you're bumping into a client that you support, and you really get to see the impact you have on their lives each and every day, even if it's just saying hello to somebody in a waiting room waiting for a clinic, or a resident of one of our facilities who's waiting for the mailman. It's just a constant reminder of why you do what you do every day. And that just, for me, that helps keep me grounded and is really, what I look forward to every day.
Awesome. Well, I appreciate your time. It was good getting to know you a little bit better, and thanks for everything.
Thank you very much for asking me to be part of this.
Hey, anytime. Thanks, Steve.
Welcome.